So let's hop back into this case. If you miss this diagnosis, your patient can literally go blind. Now, what you wanted to do on your exam, which is a can't miss thing to do on your exam, is check an eye pressure. How do you check an eye pressure and what is that? So we all have pressures in our eyes, and you can use something like this called tonometry or some kind of tono pen to check the pressures of the eye. A normal eye pressure ranges around here to here. This patient's eye pressure was this. That is a big problem. This is a true eye emergency, a true ophthalmologic emergency. And so, kind of the pathophysiology around this, fluid can't leave, so it builds up. Then you have increased pressures of your eye, which causes damage to your optic nerve and then can lead to vision loss. And this happens when the drainage of the eyes, so we all have fluid in our eyes. That's how we keep our eyes moist. When the drainage of that eye is not working properly, that can build up and lead to elevated eye pressure. This causes a red eye, mid-dilated like we saw, blurry vision, halos, headache, nausea, vomiting, and honestly, you'll pretty much snag the diagnosis even before getting the pressure, but the pressure just solidifies it. Now, what you want to do is you want to start medications immediately, as fast as possible, because like we said, this is a vision-threatening emergency. So, medications such as Timolol, aproclonidine, pilocarpine, IV mannitol are things that you want to get going, and you want to keep an eye on these pressures to see if what you're giving is helping. Now, if your hospital has ophthalmology, awesome, consult them. Sometimes this patient needs an emergent procedure. If your hospital doesn't, unfortunately, this patient needs to be transferred to some type of hospital that has ophthalmology, and sometimes that can be really hard to find. Definitive treatment for this is usually a laser iridotomy, and I can't do that, but an ophthalmologist can. Now save this post for your next EM or IM rotation so that you can stand out on your rotations. Bye!